Welcome to the EZDebride Apple demonstration course. For this lesson, the following items will be needed. First, your EZDebride wound instrument, a freshly cut apple, if you have an orange, a curette, a container of water for cleaning the instrument. You can have normal saline if you prefer, 4x4s, and or handy wipes. In this case, we'll be using the handy wipes for cleaning the instrument, and also you want these available to clean your hands following the Apple demonstration. We prefer 4x4 gauze if you have it. That's the most preferable method of cleaning, and we'll demonstrate that. Before we begin, take your instrument, and at this time, I'd like to point your direction to the website. If you have not already viewed the 16-minute pre-recorded video and hand techniques, please do so now. With the EZDebride wound instrument, firmly grip the instrument and place your thumb directly over the bulb. The bulb is an area, fulcrum, by which you can apply pressure with your fingers. You can actually grip this area as well. Next, take your palm and then begin to push on the bulb here with your thumb, exerting pressure and flexion over the neck onto your palm, and you'll feel the cutting flutes located on the bottom engage into the palm area as such. Next, slowly draw the instrument across your palm. You'll feel a tickling sensation, but not a pricking sensation. Notice, the instrument will not abrade your skin nor your glove. So one of the advantages here is that you will not have a finger stick injury. With a little more pressure, exert down on the head, harder on your palm, and you'll feel that with a little bit more pressure exerted over the bulb onto the neck, you'll get a bigger purchase and a deeper purchase while debriding. Next, take an apple slice. It's demonstrated here. The first step is, again, grip the instrument tightly with your hand. Place your finger over the bulb as demonstrated. Take the apple, and on one of the flat sides of the apple, press the instrument into the apple, and you're going to hear a crunch. Withdraw the instrument, and you can see small areas of markings from the cutting flutes. Again, press the head into the apple. Again, you're going to feel a small crunch. Do it again until you become familiar with the pressure application across the neck here. Next, firmly grip your instrument, place your thumb over the bulb, into the apple, and gently draw back. Again, try it again. Push into the apple, grip, and draw back. Doesn't take a lot of pressure, but you can begin to feel the debridement here. Next, push into the apple, and instead of stopping, go forward. This is called a brushing technique. What you're doing is slowly debriding the surface of the apple in a gentle fashion. I'm barely putting any pressure exerted from my thumb onto the neck. I'm just letting the instrument just glide across the surface as shown. Next, gently wipe off the surface of the apple, which you debrided, and notice how smooth the debridement is. And you can see that we got a nice portion of debridement done compared to the opposite side. Notice the apple material collected in the flutes. And to clean it, this is very, very simple. Take your water container, take your instrument, and swirl it around a few times. And that will go ahead and remove the apple debridement particles within the cutting flute. Another way to clean the instrument clinically, which is the preferable method, is you take a 4x4, and as demonstrated here, we're using a handy wipe. firmly place the 4x4 on the surface with 2 fingers holding both ends, and you firmly debride into the gauze. The gauze is composed of small strings, linear and vertical, and those small fibers will catch the material, granulation tissue, fibrous material, in the cutting flutes and draw it away and outward from the cutting flutes. But again, this is the most preferable way to cleaning an instrument. You can actually hold the gauze and do it this way as well. And we'll demonstrate that here as we debride further using the handy wipe to go ahead and clean the cutting flutes. Now that we did one side, take the other side. We demonstrated what is called the brushing technique by going back and forth. This technique is called the Mayo technique. Grip the instrument in the palm, place the index finger directly over the head, and go ahead with a brushing technique and let your index finger apply pressure and at the same time guide the debridement. Get a feel for the head, get a feel for your debridement, and notice now a circular movement over the debrided surface. So you can actually take this instrument and do a circular motion instead of a back and forth as such. Let's demonstrate this on another freshly cut apple. So again, grip the instrument in your palm, index finger over the head, and do a circular debridement motion as such. The instrument will cut going forward and coming back, as well as doing a circular rotary motion. This is again called the Mayo technique. This technique is very, very useful for larger wounds. It covers a large span in a very short amount of time. You have the added benefit of the finger controlling where the head is going, as you can see here. Again, we're going to demonstrate the collection of material and debris built up in the cutting flutes. And at this point in time, instead of using our container of water or fluid, I'm going to demonstrate on the handy wipe. Now again, the preferable method is using a 4x4 gauze. Place the gauze or handy wipe directly over the center of a surface. With your index finger and thumb, hold it tightly and just debride into the gauze as such. Notice, it's not going to abrade or cut through the gauze or cleaning cloth. And notice, it's not going to abrade your hand as well or your gloves. Take the instrument, hold the gauze, and you can actually firmly go directly into the gauze as such and clean the instrument this way. Now notice there's still some apple debris in here. That is because this is not a gauze, it's a cleaning material here. So I'm just going to take the fluid and swirl it around, and that's enough to go ahead and agitate those particles out of the cutting flutes. Come back with your cleaning handy wipe, just dry it off. Okay? So I'm going to demonstrate another technique which is very useful if more pressure is required. This is called the pressure technique. So instead of gripping the instrument back here with your thumb here, choke up on the instrument, grip the instrument towards the neck, place your thumb directly over the head. Now when you debride, you can see your thumb is going to exert pressure directly above the cutting flutes here. So this is going to prevent you from, if I need a lot of pressure and I'm going to bend the neck here, it's going to provide support in allowing much more pressure instead of pressure back here and risk of breaking the neck. So again, choke up, place your thumb directly over the head. Now push down. You're going to feel a firmer bite and more pressure can now be added. So we demonstrated again on the apple here, and notice it's still very, very cleanly debrided. There's no grooves and there's no depth to it as far as little holes. So to demonstrate this technique and what it can do, let's take the apple core here. The material is much harder. I'm going to grip the instrument once again, place my thumb directly over the head, and now I'm going to go ahead and debride the apple core, which is very, very hard. And basically, I'm just putting pressure with my thumb. I'm not exerting a whole lot of pressure, just enough where my cutting flutes are being engaged with that hard apple core. And I want you to notice how smooth this debridement is resulting in. Again, I'm not creating grooves, channeling, or fissuring underneath, but what I am performing and accomplishing is a wound debridement, or an apple debridement in this case, in which I have a very, very smooth layer here. And that's what you want to achieve with the EZDebride. Again, that's called the pressure technique. Simply choke up, grip, place your thumb directly over the head. And again, let's take our water. Clean the instrument off. So those are 3 techniques. Again, demonstrating the brushing technique back and forth, holding it traditionally. Mayo technique, you can go forward, you can come backward, and in a circular motion as such. And the pressure technique this way. So at this time, we're going to flip our apples over. Flip one apple over. Take your curette, and with the curette, the whole objective is, let's imagine that the apple skin is the very surface of the wound. So our objective is just to take the top layer of that skin off, if you can. And we're going to take a curette first and try to do that very, very gently as I press in with the curette and pull here. You can see, no matter how careful I am, the curette seems to be taking on different depths when I do purchase the skin very lightly, as you can see here. So I am not getting the skin directly as I wanted to. I'm actually at different levels, and you can get an idea by the contour of the depth of that debridement. It is not controlled depth, and that's one of the advantages of the EZDebride with its design cutting flutes, up to 1.6 to 2 millimeters in your first debridement. So now let's take the EZDebride. Let's leave that apple there. Let's flip this side over. Let's see how the EZDebride compares. On this technique, I'm going to go ahead and use the Mayo technique. Why? It's an easy technique and it feels very, very natural and fitting in my hand. Plus, I have the advantage of my index finger guiding where I want the debridement. So I'm gently going to get this started. I'm going to press down on the skin just light enough where I can feel the cutting flutes engaging. And I'm going to go ahead and start my debridement here in a circular fashion. Now, if I needed to, I can work off of this end. I can draw it back like this. It's very lightly. I'm not putting much at all pressure on this debridement. What I'm doing is just gently lifting that skin off of the apple as noted. Let's compare. Curette, EZDebride. And again, if I take this curette and I go on the surface, and when I hit the edge, I go inward. And it's like hills and valleys inside, up and down terrain. Now, when I take the EZDebride apple, I'm going directly flush over the wound surface, as you can see here. Again, curette. EZDebride. You can run your finger across that and see how soft that contour it is, as well as flushed margins. That's the other exercise I would like you to complete with EZDebride versus the curette. Let's go ahead and take the orange now. And again, let's put the curette to the test. I'm going to gently clean the curette off here. And what I'm going to try to do with this curette is I'm going to try to go ahead and deliberately take a couple swipes off the orange peel and try to avoid the orange inside. And again, I'm getting through the orange peel okay, but the problem is I am violating the pulp there. You can see the juice of the orange coming out. Not doing a very good job. I'm just trying to peel that orange. That's better. It's a little better. Oops. And again, but you can see with the curette areas here where I penetrated into the pulp of the orange. Again, imagine if the skin was the outer boundaries of the biofilm and or the wound, and you wanted to protect everything underneath that green color. Say I wanted to breed and try to get some of the rind of the orange, that yellow appearing tissue there. Again, I'm going to try one more swipe here, see if I can do that. And again, no, I'm trying to reach that yellow instead of the pulp, and I'm not doing a very good job. So let's turn this orange a little. Let's take one of our EZDebride instruments and see how well we do here. Now, again, demonstrating with the Mayo technique. Let's go ahead and see what we do in comparison. So again, I just want to simply start the peeling process here. I'm hardly putting any pressure on there. Okay, and what pops out to me first of all is the skin is intact of the orange or the tangerine. You see the yellow fibers, the septum in between each individual piece and slice of tangerine here. When I rotate it over here, you see the violation of the orange itself. You see the pulp exposed there, and I'm not getting those striations across here, but I am there. So a major difference using the EZDebride. I'm going to take the EZDebride one more time, and I'm just going to gently come across and say I just wanted to lift off the orange color to get to the yellow color. You can see I'm barely using any force, but the EZDebride is strong enough and engineered precisely to do a controlled depth debridement on just about any type of wound you can think of, and any type of skin, epithelial, dermal, subcutaneous layer, thickness you want to challenge it with. Again, there is that underlying rind, if you will. And again, let's try to do the same with the curette. And again, I'm going too deep here, and I'm just trying to control it. I just can't seem to It wants to seek its own level of debridement, if you will. And again, easy to breathe on this side, just lifting off the surface, curette on that side. So if I wanted to get a little fancier, what I can do is I can go ahead and continue my debridement till I reach the very edge, the very outskirts of the orange pulp itself. So again, controlled debridement, controlled skin depth debridement, getting everything going here. So you can see the layering effect with the EZDebride from the very surface to the deep, but with the curette, it just seems to be uncontrollable where I'm going very deep and not able to attain such a finite debridement here as demonstrated. So again, I'm going to demonstrate it one more time with the EZDebride. I'm going to gently just remove some of the surface. Mayo technique, I'm going to speed it up to show you you can go very fast with this technique here. And you can see I'm just gently debriding the surface peel into the yellow coloration of the orange. That's where I want to go. I don't want to get to the pulp. I just want to get to that layer there. And you can see it there and there. This concludes our apple demonstration, and if you want to include the orange, we could call it an apple orange demonstration. But I think you can see the effects of the EZDebride. It's a very fun little exercise to do, and of course you can do it multiple times and practice at your proficiency with the EZDebride instrument. We covered several techniques as well as advantages of the EZDebride over the curette. And again, don't forget our webpage link, which is provided. We do offer a pre-filmed lecture. It's a 16-minute video, which demonstrates multiple hand positions from the two-finger technique to the Mayo technique, the pressure technique, and how to utilize different areas of the cutting flutes, as well as cleaning the instrument. The video, which is pre-recorded, also contains shorts on how the instrument is used in wound care on live wounds, demonstrating all these techniques from thick wound edges to an epiboly to creating a bloody, not bleeding wound. And there you have it. Again, thank you so much for your interest in EZDebride. You have a great day.